2nd of April 2022 is the day lapho sicelebrate khona i-Autism Day. Iningi labantu, especially bomake abanabantwana abagulwa i-autism noma ingane ezikhula ngaphakathi kwalomntwana one-autism endlini, bathola ubunzima kakhulu ngokuthi bakhophe okanye ukuthi bamnakekele kanjani lo mfowabo noma udadewabo one-autism. Kepha namhlanje kwezempilo zomudakalo with Dr Pru sizobe sibuka nana nalolu daba kabanzi kanye singene ekujuleni kwalo. Angihambi ngedwa ke, ngihamba nginezihambeli zami, uDokotela Mabeba ozosichaza kabanzi ukuthi uye bani, alandele uSis Nomsa Masoka kanye noGugulethu Nkosi. Ngicale ngawe Dr Mabeba, ukatla usetsa mu ko hae hore ke mang Dr Mabeba?
Ke leboga Dr Buthelezi for having me, Dr Pru for having me. Nna ke Dr Mabeba, ke child psychiatrist and ke shuma in private practice, mainly in Pretoria and children.
Re leboge thata Dr Mabeba. Sis Nomsa Masoka, ungathi ubani uNomsa kumbukeli osekhaya?
Nomsa Masoka. My name is Nomsa Masoka. I'm a speech therapist and audiologist. I'm also a mother to an 18-year-old son who was diagnosed with autism. And through my journey of raising my son, I realized that there's no support for parents that have children with autism. So because of my own journey, it motivated me to start an organization called MOCWA, which means Mothers of Children with Autism. So I am the founder of the NPO since 2015.
Releboge Sis Nomsa. Sis Gugulethu, ungathi ubani uGugulethu kumbukeli osekhaya sis?
Greetings to you all. I am Gugulethu Nkosi. I am a single parent and have a son who is autistic. He is currently 11 years old. And here with me, I have my sister Pumla for moral support because she's been with me through the whole journey from day one. So if I get a little bit nervous, she will take over because this is still new to me, but yeah.
Sibonge kakhulu Sis Pumla ukumsupporta because lolu hambo vele uma uwedwa alusilula, lunzima kakhulu kanti support enjenge yakho Sis Pumla iyadingeka kakhulu. Sibonge kakhulu sisi. Dr Mabeba.
Thank you so much.
As a psychiatrist le psychologist, kanti difapana jwang pila?
So thank you for that question because I look confused about you. So a psychiatrist first studies for medicine. So you go to a medical school, you do MBCHB, you finish that, you do the internship, ComServe, and then you study for 4 more years to become a psychiatrist. And on the other hand, the psychologist is somebody that can do a degree and they major in psychology. They do an honors in psychology. They do a master's in psychology, and then they can become a psychologist. And there's different types of psychologists. We've got educational, clinical, industrial, counseling. So the big major difference is that a psychiatrist becomes a medical doctor, and therefore they can diagnose and prescribe medication. But what I can say is a psychologist and a psychiatrist need to work hand in hand. None can work without the other.
Okay. No, wa tlhalohanyega sentle fela. Dr Mabeba, a re tsene mo tabeng bjanong. Today re bolela ka autism spectrum disorder. Mo mothong o le ko hae, batho ba itlhalohanye autism. Ke kopela o itlhalose ka leleme la rena o zame nje go be in a good picture gore he re bolela ka autism re bolela ka eng o ebe o iragalang go lwala eng ke boko or ke letswele kopela o tlhalosetse ba bogele go gae
ba boge ore ke tlo leka go bolela ka leleme la gešo la Sepedi bothata ba because we use a lot of scientific words. Some words are missing, like autism spectrum disorder. We don't have it in our language. Autism spectrum disorder, brain. It's a neurodevelopmental disorder. It means there's something that went wrong, right? Neuro means brain. Developmental means growth. So, autism, structure or growth of the brain. And autism, but more autism spectrum disorder. Mild, moderate, and severe. Before DSM-5, what we call high functioning and low functioning, and we have moved from that because high functioning and low functioning, then we tend to forget or autism we need support. Let me talk autism. Number one, but autism, banali problem ya hore banali deficit in social communication and social interaction. But autism bala the social cues, communicate ba sokola ubulela, and sometimes they're non-verbal, and they sometimes, because of this problem, social communication, banally problem who develop relationships and maintain relationship, and they get quite misunderstood. So that's one of the biggest feature. And the second feature about autism, so for instance, usually go crash, crash, one on the spectrum, bana busy playing, ali on the side playing alone. So they tend to isolate themselves. But a problem they struggle to form social relations, and social interaction is a problem. And the capability to reciprocate or wish that social interaction ever would have. So I'm trying to tell you about the symptoms, the autism. And I'm so happy, really, two parents that are having children who are on the spectrum. They'll probably explain better what they experience. And the next thing about autism, they tend to have what we call restricted interests. So, or if they're interested in something, they stick to that, and they can zoom in that and only want to talk about that. And even their behaviors. And with those two are the main features the DSM-5 ijibulela. But then I'm going to add this is what I see when the children come to me. So Hanchi, when the kids are brought, they are brought because wana u develop handle, and then wana nabuwa by 2-3 years the child was saying a few words, and suddenly the speech disappeared. So speech usually is the main thing ever to represent wana hasa buwa. So they can have no speech, they can have delayed speech, or the speech can be impaired. So this is the biggest symptom ever to represent Tankayon. And then hence unka history, and then one I interact. How does this child interact? No, this child doesn't interact with other children or even with us. And then you ask about, then you start asking about the other things like sensory things. How is this child in regards to senses? Usually, Banaba autism, they either have hyper aroused senses or hypo. In other words, they can be very sensitive to some sounds. They can be very sensitive to some touch, some smell. It can be either hyper or hypo. So you ask, you get those things. Again, bana ba autism, they've got atypical development. So then the important thing is to take history. Ask about the development. Mwana, at a certain age, like from 2 months, 3 months, 4 months, we expect certain things, normal milestones. Does this child make sounds? Did they return? Like, kitlafa the examples. You know, from a 4-month-old baby, we expect to recognize the faces. So if the mother leaves the room or the caretaker leaves the room, the child must show some reaction, either amulele or abonto the distress. Kids with autism, no one doesn't even show any reaction where the caretaker is gone, or when the caretaker comes in, they don't show any reaction. So I'm just picking up a few things that we can pick early. But the main thing that comes out is the social interaction, social communication, and their restricted interest and how they interact with people.
Oh, really, Dr. Mali. We really handle fela. Sis Nomsa, njengoba dokotela eseshilo impawu abantwana ababonakala ngazo abane-autism, wena yiziphi impawu mhlambe owazibona, and wazibona umntwana how many years? How old was your son by then when you see ukuthi man kukhona lokho ongahambi kahle? Yiziphi futhi le mpawu owazibona sis?
At the age of 3, I think around 2 years. Basically, let me say my son was actually developing normal. He had acquired a bit of speech and language. So the other thing that we never get told is that there could be a regression whereby the child develops the milestones, and at some point there's a bit of regression that happens usually around the 18-month period to about 24 months, and towards 3 years, where the child suddenly loses his ability to communicate. So that's what that was the sign that I saw with my son. He started to look like he's mute, like basically mute, whereby I would call him and he would not respond. And as an audiologist and a speech therapist, my first thing was, I think my son has got a hearing problem. So maybe that's somewhere where I should start to actually have his hearing tested. So I got his hearing tested and checked if he's got any other things like middle ear infection. And, it's so common to actually also find that our children have got middle ear problems. And I think it's got to do with this gut and brain thing where, most of them have difficulties with their gut, when they eat certain things, and I had noticed that during that period, we also gave him a lot of antibiotics. And then that's when he took a nosedive, basically in terms of his behavior. It became worse. Then he started to behave strange. Like he started to do the hand flapping. So once I started to see the hand flapping, I was like, tonight. And so and he would start playing with his fingers again at night, and he would go around the house playing with the twig. So his playing skills, basically, like Dr. Mabeba also mentioned, that he started to want to play in isolation, not wanting to be with other people, and also becoming a bit clumsy. So you may find that they also have like these fine motor problems where the coordination was not great in terms of, even though physically there is no impairment, but it's the actual coordination. So most of them, it's more of a processing problem, where again, with my son, they started deteriorating in terms of taste. He started to prefer food of a certain texture. So, the way they perceive things in the environment, and through our senses, we taste, through our senses, we hear. So when he started to hear noise, he started basically cupping his ears. And then in terms of taste, he started to eat food of a certain texture, which was like, your mashed potatoes and your yogurt and things that were a bit bland, which was something that was quite strange. You used to eat certain things and then he started to prefer eating, the same things all the time. And like I said, speech then was not what he lost his speech. He lost his ability to understand even instructions as well. So there was also language expressive, which is, being able to express yourself, and receptive, which is problem with understanding instructions. When you ask him to go and do something, you would have to repeat over and over.
As a speech therapist, you said there was there's this verbal and non-verbal autism. Can you about difference between a verbal and a non-verbal autistic child?
With regards to a verbal and non-verbal, verbal would means anything that has to do with our language, being able to speak, basically being able to articulate yourself using expressive language, where the child uses, they say the things that they want to say without necessarily pointing. So a non-verbal would be anything that has to do with your gestures, basically. It does not, but all of this it's impairment with regards to communication, because sometimes the child tries to communicate, but the communication is not happening verbally, where he points at things. So that would be when the child becomes non-verbal. They don't say it, but they still would pull you to show you that they want something.
Okay.
So that's where yes.
Okay.
Yeah.
So as a speech therapist, when you notice that the child, she's not speaking or she has a speech problem, at what age should the parents start to consult with you? Exactly. And do the speech therapists usually, or do they normally assist on a child who has an autistic speech difficulties?
I normally say by the age of 2, like I said with my son, by that time they should be able to put together a sentence of saying what it is they want. So if by 2 years there is a speech problem where the child is not able to communicate, they are, by 2, they should be able to put up a sentence to say, I want this, even if it's not very complex. I think from 2 years, you should be able to see a speech therapist, even between 2 and 3, to be on the safe side, 2 to 3 years old.
Okay, so as long as they start early, the speech therapist, there's something and they will be able to develop some speech.
Yes.
That's what. Okay. Gugulethu.
Sorry, not to say they will develop some speech. Let's be honest with the fact that some of the children who are on the spectrum may not develop speech, and due to other reasons, because like Dr. Mabeba said, everything has to do with the brain, and there's a part of the brain that is responsible for helping us to articulate speech. So that's why there's something called speech motor apraxia, where there's child does not even know. For me to say Papa, I have to put their lips together. So that's what you normally find with children who has autism. They can still voice, nothing is impaired in terms of structure, but it's the whole process. Yes.
Okay, it's clear, sis. Gugulethu, wena-ke ungasichazela sisi njengokuthi umfana wakho yena waqala ukubona ngaziphi impawu ukuthi kunenkinga, and waqala ukusukuma nini ukubona nabo dokotela, and umuphi udokotela wokuqala owaya kuye mhlambe ukuthi ubone ukuthi uthola usizo kanjani?
Okay, listening to Mam Nomsa, me and her shares a lot similar, like with from the age of 2, I noticed that Sino had a speech delay, because already his peers were talking and Sino, there was no sign of words or babbling. So I knew that something was wrong. And the first thing I did, my mom and we took him to a hearing institute. Check everything is fine, and results came back positive. And the doctor said, no, the child is fine, he can hear. From then, we started speech therapy. And then because I'm in Nelspruit, we don't have a lot of speech therapists or the whole, how do I say it? We don't have a lot of doctors that are familiar yet with autism. My first speech therapist, it was a challenge because bekamfundzisa sign language. And then, okay, a child who is autistic, he gets bored very easily. So bamfundzisa, he's got a problem of speech and autistic, and they get bored easily. So begaba irritated. We weren't getting anywhere with our first speech therapist. And then luckily my story, my mom's friend has a son who is autistic. So through my mom's friend's son. And then sometimes she'd refer me to doctors and I'd go to those doctors. And then my first suitable doctor was Dr. Leidenberg, but she is late now. She passed away because she had what is it again? Cancer, the throat cancer. But she was the best speech therapist. What she does, she trains the child from scratch. Luguti, yomfundisa my name, stand up. So we were getting somewhere. We started getting progress from Lapo.
Okay.
And then she advised me to take my son to a neurologist, which he never diagnosed, doctor, this is what's happening. And then autism is a very broad spectrum, but your child is autism spectrum. And then got medication, started OT, and then he started getting better. But it was, yeah.
Okay. Yeah. But initially, sisigugu, uma bekutshela ukuthi nje bekutshela nje ukuthi usino umfana wakho une autism, how did you feel initially? Kwenzakalani emqondweni wakho?
I was very heartbroken, and this journey is a very sad, or it's a very depressing journey. You always ask yourself, why me? And then you always Google stuff, and then you ask yourself, where did I go wrong? So I did blame myself at some point, but after a few years, I accepted the situation, gave my son all the love, because they need lots of love, they need support, and yeah.
Okay, asibambe lapho sisigugu, sibuyele kuwe Dr Mabeba njengodokotela wethu. Ngifuna ukwazi la ukuthi kahlehle yini imbangela, njengoba usisigugu esho ukuthi bese siblame yena, mhlambe bona ukuthi mhlambe ipregnancy khona lokho, mhlambe yimaphi ama risk factors or yini imbangela, the causes of autism?
Thank you. We don't currently know the exact causes of autism, but we know there are different factors that could be, used. For instance, we know that it's genetic, so it's hereditary, which means if there's someone in the family who has autism, the chances that their next generation can be autistic are there, and there's gene mutation involved, right? Number two, we know that we can have biological factors. So biological factors can be anything during pregnancy, post-pregnancy, during the delivery itself, or post-delivery. Anything can happen to affect the brain. Sometimes we say, the maternal factors could be like if a mom during the pregnancy gets some infection that could be spread to the unborn baby. So those are the biological factors, right? During delivery, things can go wrong. There can be birth trauma. maybe when it's time to be delivered, they take long, they get deceleration, they get, all that. They can lead to problems within the brain. During delivery, there could be other things. Maybe there is forced delivery, and when the baby comes out, they could have asphyxiated. So post delivery or during delivery can be problems. Number 3, we know that environmental factors could also, cause problems, like toxins could cause problems. And there's some factors that we can quote, like maternal nutrition, ages of the mothers. Sometimes if people are elderly mothers, elderly parents, that could predispose to autism. Premature babies. So, if a child is born like at 7 months and their weight, give them 700 grams, it takes too long for them to catch up. And at that time, the brain can get insults. So those are the factors that we look at. Prenatally, sometimes certain medication that the mom takes could affect the baby. Neurologically, there could just be delay in development of certain parts of the brain. Like Sis Nomsa Ashilo, each thing is represented in the brain. Your language center is represented in the brain. So there could be delay in the growth of that part. But other parts of the brain, they develop now. So the other milestones will be normal. So there could be delay. So those are the factors, the risk factors that we look at. But at any given point in time, I can never pinpoint and say, these are the causes of you having autism.
Yeah, no, ke nnete eo e se re bona Gugu le Nomsa a se batho ba bagolo thata gore ke elderly primigravida, so hora hore hona le tse dingwe tse vele hore di ka ba di causes. So ke batlo tseba mo he sentse motho a bona hore di sign and symptoms ke nkare ke tsona tse o ka mo advise wa reng motswadi o bonang di symptoms tse o go high bona byanong hore tshwantse maybe I am a doctoring tshwantse o ira heleng.
So what I've learned over the years from experience is the mothers, they have the instinct. So when even if one are before 2 years, when the mother I had to the of the mother is important. Mama something isn't right. So this is one thing that I want to stress. It gets very dismissed because I trust the mother's instinct that if the mother says something is not right with my child, and usually kita by speech, and they get turned away sometimes. When on child, speech is 2 years, 3 years, and so on. But I say to the minute a mother says there's something that doesn't sit well with me, that's the first point of departure. And my advice, secondly, is to go and seek help, either to the clinic, to your GP, and say, no, I can't look at this. Rather have a child that is over-investigated than a child that is not investigated. Because sometimes this autism gets missed, right? And what happens is for a child to be diagnosed with autism, you need a whole MD team, multidisciplinary team. What we need: psychiatrists, psychologists, autists, speech therapists. You need that whole team to diagnose. And the diagnosis is made through many things. One of the things is through the interviews, clinical examination, observation, and at times there's some screening tools or tests that are done to diagnose autism.
No, ho utlwahala thata Dr. Mabeba. Sis Nomsa, size kuwe. Njenge speech therapist umuntu osebenza kwezempilo. Naku umntwana sebeyakutshela ukuthi une autism. How did you feel ke wena by the time mabekutshela nje ukuthi umfana wakho une-autism? And what did you do immediately from there?
Okay. Okay. Mina, when my son was diagnosed, it must have been, now he's 18, so it must have been 14 years ago. Okay. When he was diagnosed, there was no support in terms of counseling for me. So Nami, I was a parent who just went and researched, like, the other mom said, find out more information. And again, during that time, there were not a lot of speech therapists who had expertise with regards to being able to treat autism. And at that time, I remember when I used to send my son to Johannesburg School for Autism, the therapists that worked there were literally the students that I lectured at VETS. So it was even very difficult for me because I knew a lot of people within my profession, and I knew that at the time there was not so many who were specialized because it was still coming up, and we were not having things like ABA at that moment. So for me, again, it was more of me trying to assist my son at home, buying him educational stuff, doing whatever that I could to stimulate his speech and language. However, as time progressed, things became better because then we started having things like, now we have devices, now we have picture exchange communication symbol, and most of our teachers and our therapists are mostly trained in autism. But I must say, as a parent, it was very difficult for me because I struggled to find someone that I knew was specialized in. I knew they would give speech therapy, but it was just the specialization in autism as a speech therapist that was lacking at the time. And so I basically tried to help myself at home, but he was still receiving speech at school. Yeah.
Okay. Sisigugu, sisibuye kuwe lapho. Unayo yini wena ke i-support nje immediately, because ngokubuka kwezinto abomake abaningi baba ku depression. Did you find a psychologist? How did you cope nje with all this?
Luckily enough, I have the best support system at home. So I did not get to a stage where I am depressed, because if anything felt wrong, I would just tell my mom and she would give me that counseling. My dad, my sister, they were all supported throughout the journey until today.
No, I can see even your sister, she's here to give the support. That make maybe this road to be easier for you to handle all this, eh?
Yes, and also opening up, it also helps. When you talk and let people know that, no, my son is going through this, it helps because they start understanding. Unless whereby now explain this is what's going on. So I was open about it, and with the support, everything was just smooth.
Okay. Good evening, everyone. I'm the clinical psychologist, and I've been invited to come through because it would help Horere, she said, the aspect here, psychology and psychological intervention with children battling autism. Thank you so much.
Okay, thank you. Sanelisiwe, would you like to introduce yourself?
Good evening, everybody. My name is Sanelisiwe Malaji. I'm the one that Maji just said I must introduce myself. I am a mother of a 13-year-old boy living with the autism. He's on the mild spectrum. Thank you.
Mary Kane, can you maybe go deeper in what you do and how do you get involved with autism? And what type of help do you give to those who suffer from? Yeah, thank you.
All right. Thank you. Okay, my job entails offering psychotherapy, offering support therapy, and also especially with parents while the children are still small, like the speech therapist was saying, when they are still around 2, 3, or 4 years, it might be difficult to offer them psychotherapy because with them, they take long to develop. In that spectrum, they take long to develop their emotions and to understand them. So we'll usually give supportive therapy to the parents because they will be also shocked. They're going through a lot of trauma. You know, when you bring a child onto the earth, you are expecting that, you know, you're going to attach well with each other. You're going to be hugging each other. You're going to be speaking well to each other. And, you know, you'll be teaching the child how to express themselves. You want them to interact with other children and to also show their emotions and so forth. But now, as a parent, when you know, like the other speech therapist who's the mother said, at 2 and you see the child is not speaking, the child is not responding to interaction, you know, the way you would expect. Now you will start also having trauma, you know, you'll start also being scared, you know. I like that the other parent said it, that you become depressed sometimes because you are a bit disappointed in their expectations. Like, you know, I thought my child will be like other children. The milestones will show like all the other children. So now they are not talking. They don't know technically. Are they going to cope socially? You know, are they going to cope, you know, career-wise and so forth? Now you start having a lot of questions and a lot of, you know, a trauma about it. So you need to go through therapy. You need to go through the processes of being, you know, explained to, like the psychiatrist was explaining, Dr. Mabeba, to say, you know, these are the spectrums that will show with such and such behaviors, with such and such characteristics, with such and such variables. Then you'll be able to understand better. So we come in this manner, but they feel you. Okay, sorry. Yes. Oh, all right. I was saying maybe can go because it's fire work as yes. That's it. Mm. Yes. Mm. Mm. Okay. So what we usually advise that, fortunately now, because of the online interactions that are available and interventions, we advise that they can go to their clinic, nearest clinic, because that's where the access is. Mostly you find that they don't have hospitals. Go to the clinic and then they will be able to help you. You find that there are nurses and specialists there. Mostly the clinics, they use their locums, they use the interns, so then they can help you to know better. Because you find that maybe because of the funds and no medical aid, it might be a difficulty to go through those processes. But there are also, you know, online information about autism. We always advise people, check on Google, who are the people who offer pro bono, who are the people who offer their services online without having to go to that place, because maybe you don't even have transport. So that is what we advise, that people need to learn. Like I liked what the psychiatrist said, that a parent will always, especially a mother, will always have that feeling that, no, there's something wrong with my daughter. There's something wrong with my son. So then we advise that when it is like that, seek for help. Do not keep quiet about it, because when you keep quiet about it, that's when it's going to overwhelm you. And then it's going to cause you more depression, more anxiety. Now you are also affecting the child. You know, as you said, a colleague, that the mother said at home, there is so much support. So it had helped her not to even seek psychotherapy. Because when you talk, actually psychotherapy, that's what it's all about. When you talk and talk, you heal. It becomes easier to manage. So when people keep it in within themselves, or maybe they're ashamed, in the house, you are frustrating the child also in their developments. So we always encourage parents, take the child for a walk. Let people also get used to the kind of child she is. When they greet, maybe he doesn't greet. When they talk to him, he doesn't talk back. And then they can understand what is happening. But you also can be able to explain to them. So I want react to especially strangers. They take long to feel, more comfortable, especially with strangers. So now you can be free and you can be accepted. Now it doesn't look like a stigma. So that's why the problem is that we do not deal with it. You find that there's also couple, banale autism. They don't talk about their frustrations. They don't talk about their fear and their disappointment. And now you find that one of them maybe might leave the child, and now the child is suffering even more, the trauma of being left alone or neglected or rejected. So we encourage tlang for thuso re tlo le thusa le check gore re ka thusiwa kae ngwana ha right, and le maikutlo a rena a sa le right, we rapallwa, like it's overwhelming to deal with ngwana, because ngwana le ena what do you sense are those emotions, but they don't know how to interact or react to them. That is why sometimes you find that they will be screaming, they will be, acting out of the normal behaviors. They become even violent and aggressive, because hale maikutlo a lona ha ya ko speech therapy a khone gore ke ikutlwa ke le botlhoko wa bona, ke ikutlwa ke tshaba wa bona. So o khona gore at least a express ntho tseo. So ha lona mo ntlong le na le I don't want to say ntwa, but ha gona le tension mo lapeng le sa dile le yona, it will affect why feel it, because there's also an element of attachment. But now I know how to deal with it. So we always encourage parents, buang a khone go bua le ye.
Okay, thank you, Mr. Maja. Sis Nomsa, siseqhubeka njengoba sesizwile kakhulu. Ngiyazi ukuthi unale organization yakho imukhwa. Ngicela ukusithathe usibeke ngayo ukuthi so far ifinyelela kangakanani ebantwini, ingafinyelela yini nakumanye ama provinces, kanti ungibanceda kanjani abazali?
Okay, i-support group yethu basically sine WhatsApp group. So
Okay.
it's so nice because when we've got a WhatsApp group, we are able to share information on the WhatsApp group. And people are also welcome to send me WhatsApp and say, yo, Sis Nomsa, I'm struggling with toilet training. And then I will try and explain, okay, for you to get toilet training, these are the steps you need to do. And then sometimes, like today, parents we were talking about oral hygiene, oral health, basically. And some parents would be saying things like, my son actually chews on a toothbrush. And then, and another parent would say, Mina, you know what? I saw this 1, 2, 3 works. So the WhatsApp group here, it's very good because we share information. And what's nice, when I'm in that platform, I'm there to oversee information is being shared in a very professional manner, but I'm not the dictator, because I believe you can learn so much from other parents because our journeys are different. And I feel like each child is different. What works for your child may not work for the other child, but you can learn so many things from parents because they live, with autism on a daily basis, so they understand. So the WhatsApp helps. We also have something called once a year we have our annual high tea event. Our annual high tea event nazo ziyasiza, but I'm saying for a parent or who's outside our province, the WhatsApp is what we are able to offer at this moment when they are not in Gauteng, they're in a rural area. Yes.
No, this is a good one, Mrs. Nomsa. But in funa find out is mothers. Nabo tota mabekhuluma umme ke yena tlhokomela ngwana. Kanti bashona labo baba bona. Sithini ngalabo baba? Abo baba senza nabo labantwana. Singathini kube ubagcuzelela ukuthi
Okay, that maybe I can put in some point, especially with parents, with fathers.
Yes.
I don't know, maybe what network she's not coming through.
Okay.
Yes, I had said earlier when you were off, you know, also couples, they need to be involved in helping the child, because you find that now the other, you know, like a father usually, because they take long maybe to understand autism, they may just distance themselves instead of expressing next I expect something so get disappointed. You understand? So that at no wana go kula so a se gore re loile wana go kula so ha se gore go na le phoso ka rona, as Dr. Nacho gore it's hereditary, it's genetic, and even as experts are so tsebe go itlhalosa gore ke eng, it's just a spectrum, like if a child anale ADHD, you see, like if a child anale problem ya maybe you can say aneurysm, or if a child, so it's just that labels. You know, now a father is expecting the son to be the heir. The father is expecting the son to take over everything. But now, when the child has autism, you become disappointed. So it's okay to acknowledge it. Now, what I advise want that acknowledge it. Bua ubueli musadi wa gago, ubueli batswadi ba gago, ubueli metswalle ya gago, bras, I'm so disappointed. Le montate ba rata le gore ba re ba kopana kere na go le yalo ke chance bua kutlile botlhoko, yo, I'm so disappointed. People can feel you and can feel for you. Then when ba khona tla mar bra re together, don't worry, we'll support you. What is o tlo tsaya le gore ba go tsege ba go support actually. O tlo tsaya le gore batswadi ba no ngwana ke ne re na le ntate mogolo ona na le so ne re sa itse gore ntwe tse ke autism. Okay, it's not actually even from your wife, because nakongwe end up o blame mosadi because ke no ke someone kanti maybe ke ntho e tswang ko family ya go gae. O gona go accept gore now re na le like re fortunate because re se re na le access wa bona, and as nacho colleague gore okay ko maplasing ka ikare ka etsang gona tja go sana issues asore a kina a kutlele ba ko maplasing ne mara le government ya try, and I know gore gona di issues, but ba leka gore ba etse internet be available, gona di TV yana ka Dr Pru a etsa, gona le di access ya ntse ngata, Google check information gore ke manga ka nthusa wa understand the colleague yo wa etsa le di online le di WhatsApp, get information, o ska dula una ditlo bua, and then o feel better, o feel relieved. So but thank you so much for support. Thank you.
Yeah, since re tswalla bjano as medicating ke sa bua ko wena ha ke kenyaka o thuse the siblings, because the siblings setting I don't motlalohang, I didn't understand o ba frustrated, especially o wa obetana, the parents they frustrated, le bana ba frustrated, o ka ba cancela wa reng go hae tshwantse ba ithuse bjang, tshwantse ba ireng ke se swing step tshwantse ba se.
All right, ke a leboga Dr Pru. So actually, I'm happy that you say even the parents le bona banal stress. I had just spoken about it. I'm not saying all the autistic children can always be well behaved or well managed. The levels, mild, as the other lady said, the parent, moderate, severe. So some severe cases, they may be difficult to manage. So they will need also the medication about doctor. But if we support each other at home, we can work together well. For parents, I would like to say, try to balance, because now sometimes we forget what the other kids, they also need a hug, they need our time, they need that. So they will have anger towards this one. This one is getting all the time and all the attention. So siblings, hey mama, wait. We are always looking after my brother. Just ice cream fell. I understand the situation during ice cream, but to say, say your need so that you can anger towards your sibling. Condition so the sons Lina Cali talk, mama. Oscar Utlak anger, uti distance, and then osarati uswa or abutwa how, and wa go tlhoka. He may not be able to express it in the way that you know, but wa go tlhoka. Sometimes you don't have to talk. How sibling, just your presence. Uduelena mo sofa fela le shebile TV A1. Or le fana ka di non-verbal ke rata le speech therapist to the parent are non-verbal le go bona dia bua la sa buile mo re shebe eng a bone le ena gore you care and I am here, and then a choose o tlo fila lerato le ena and lady ntwa dia thoga dintwa sometimes is a le go gore le rona we are stressed, so while you feel over frustrated out so but her calm down re mo accept her go ba easy wa utlwa gore ra morata lerato ke yona ntho important.
Thank you so much, Ausmedicaine, and thank you all the time when Ezempulo Zwamutakalo needs your help. You are there to assist us. Raleboga thata Ausmedicaine. Re tla go wena sis Gugulethu.
Yes, Dr. Pru.
Ngaphambi kokuba sivale sisi. Ngifuna ukwazi ukuthi for umntwana isikolo uthole ku easy ukumtholela isikolo or noma njani yini mhlawumbe ongayithanda ukuthi ugovernment ancede ngayo as parents?
Okay, I'll answer this one on behalf of Gugu. So finding a school for Sino was not the easiest because for example, as Gugu had previously mentioned that in Nelspruit, we do not have a lot of access or, people with the knowledge. So finding a school was not easy. It was a trial and error sort of phase where he tried one school and it didn't work. And then based on referrals, he would try another school. And up until this point where he's at a school now that his progress we're happy with the progress.
Very happy.
Yeah, so it was a trial and error thing. And then to answer your second question about what the government can do and in terms of like interventions and all that stuff, I think it would, for example, it could start from the ECD phase. A lot of preschool or creche teachers are not really aware of autism and how to treat children living with autism. So, maybe in the curriculum, in the teaching curriculum, they could add sort of more about autism so that they can also understand and they can also teach other students that, hey, how to deal with that particular child, because that also plays a role. So that's one. And a big thing, schools.
Sibonge kakhulu lapho sisiphumla. Sesivala nje. We're closing now. Ningathini kumzali osekhaya onengane khona manje ene-autism ongakayi kubodokotela usasaba usahlala endlini akhala day and night, ningathini kuye?
Okay, I'll start off. I'll say it gets better. Yes, it gets better. Difficult at first, but it gets better, and do not be afraid to speak. You might be surprised. Yeah, Thank
you so much.
Okay, thank you.
Sibonge kakhulu Phumla nawe Gugulethu lapho. Sithemba ukuthi umfana wethu uzokhula kahle and abe kahle futhi empilweni kuhambe kahle. Sis Nomsa, sesivala manje. Kubantu abasekhaya ungathini kubona, especially when it comes to your organization nezinto ezizobe zenzeka on the 2nd of ozenzeka namhlanje nge2nd of April, ungabaxwayisa or ubaduduze uthini namhlanje?
Okay, I would wish that there's a lot of awareness here, autism in the communities. One, it's for the safety of our children, because majority of our children do get lost, when they ever get to go somewhere and they don't know their way. The more we increase awareness, so hence the work that we're going to have on the 2nd, it's going to happen on the 9th of April. It will help us in a sense of increasing awareness, because we are going to be partnering with various organizations where there will be people from SEPS, and the people from SEPS will be, informed in terms of how do you pick up a child with autism. Because we had one of the moms who had her son sleeping over at the police station, and we need to educate and empower them to say, should it happen that you have a child with autism at the police station, how are you going to calm the child? And when we partner with the police station, they will be able to send us messages that we have this child. And China as Mokwa, at least it will help, because then all the police stations in Soweto, wherever, but we are starting with Soweto, so that should a child get lost. So that's the main thing, that if the community can learn about autism, they will not bully our children, and they will treat our children with so much love and with respect. And we are saying to our neighbors, because we know that our kids tend to break our neighbors' windows, it's not intentional, but we must find a way that we still maintain relationships with our neighbors, because we found that most of the families that I work with, their relationships are strained when they have a child with special needs. So we're asking the community support and accept autism.
Okay. Asibonge kakhulu sis Nomsa, sibonge nakuwe sis Medicaid, noGugulethu kanye no Dr Mabeba. Ngithembe nawe mlaleli lapho ekhaya namhlanje ufundile kabanzi ngeautism. Mangabe kukhona ingane yakho ine autism, angeke usasaba ukuphumela obala, uxhumane nabo dokotela ngokuhlukahlukana kwabo uthole usizo. Kanti njengoba sis Nomsa seshilo, wonke lama organization try ukuthola ama numbers awo, uxhumane nawo. Uma wadinga, contact me ku Dr Pru. Nisale kahle babukeli emakhaya.